gut told me something bad is going on. I need some answers, and I need them now.
There was terror in Angie's voice.
You feel like your life is just completely out of control.
I felt that she could die.
I might lose her, and there probably wasn't anything I could do about it.
Next, two medical mysteries that defied the experts. Ashley Wolf suffered from chronic diarrhea for the first 10 years of her life, until a clue from the most unlikely of places reveals the shocking truth.
I was totally stunned. I could not believe it.
Then, emergency room nurse Nissa Penland was used to saving lives in the ER. But when she's stricken with a mysterious, debilitating illness, will anyone be able to save hers?
Being a patient was the hardest thing I ever did. I had really tried to be as tough as I could be, and I couldn't hack it anymore.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In 1994, high school sweethearts Angela and John Wolf are elated at the birth of their first daughter, Ashley.
She was chubby, extremely chubby, very healthy, happy.
Just always soothed, never really had any issues.
There's something special about the first grandchild. She's just a great baby, happy, great personality.
Baby Ashley seems to be doing fine, except for a particularly nasty case of diarrhea.
Being your first child, you never really know what to expect. I thought maybe it is normal.
I started questioning it after a couple months, and I was told that the stool would firm up after I completed nursing.
But even after Ashley begins eating solid baby food, her diarrhea persists.
She was having 8 to 12 bowel movements a day.
The pediatrician was not really ready to investigate it to a thorough degree, was sort of at a wait-and-see type of mentality. Let her grow out of it, see how she does.
But as the years pass, Ashley does not grow out of it. In fact, she begins to develop other strange behaviors.
By 5, I knew something wasn't right, for sure. She was too thin. She was eating enormous amounts of food.
I think when I really noticed anything abnormal, it was her diet and her eating habits. She was a voracious eater.
I had no idea what was going on. I just knew something's not right.
Angie and John's concerns about Ashley are confirmed after the birth of their younger son, who does not show any of Ashley's symptoms. The revelation is bittersweet. While they celebrate the family's new and healthy addition, their anxiety over their daughter is growing by the day. Ultimately, they decide to make an appointment with a pediatric gastroenterologist.
I took her in, gave him the entire background. I even explained a situation where she had eaten watermelon, and very soon after she ate the watermelon, 3 to 4 hours, I believe, I found seeds in her stool. And he told me that that just wasn't possible, and I was exaggerating. I felt as if he was calling me a liar. He absolutely didn't believe me. He even giggled at me.
Frustrated, the Wolfs do the best they can to manage Ashley's gastrointestinal problems. Then, later that year, they receive more disturbing news from Ashley's first-grade teacher.
She called and said she believed my daughter had attention deficit hyperactivity disorder and that we should consider medicating her. I said, I completely disagree. I spend more time with her, and I don't believe that's the case. So I ended up saying, maybe it's that your class is too boring for her.
Despite the regular diarrhea and weight issue, Ashley's condition is stable for the next several months, until one night, during a family visit with Angela's parents, something terrifying happens.
She woke up in the middle of the night, screaming in pain and feeling like she was going to vomit.
She was screaming and crying that her tummy hurt.
Just, crying and scared and not knowing what's going on.
The first thing popped in my head was appendicitis, but we really didn't know.
They rush Ashley to the local ER, where the doctor on call performs a thorough exam.
They said, it's not her appendix, it's nothing serious, take her home. So I took her back home. couple hours later, she was screaming in pain again. So I took her back to the emergency room. The doctor decided to take an x-ray. And he said, I'm not sure, but the film is not quite clear, but it's possible she has some kind of blockage in her intestine. Take her back home, and if needed, if it doesn't subside, bring her back again. So I did.
But several hours later, Ashley is still writhing in pain. She refuses to drink any fluids and is getting weaker by the minute.
We're back at the emergency room again a couple hours later. The doctor, he said, I don't see any problem, but she's starting to get dehydrated. You need to make sure she drinks, or we're gonna have to do an IV. I said, why don't you just do the IV, because she won't drink. Well, I don't think that's necessary, so why don't you take her back home?
I was totally stunned. I could not believe it.
By morning, Ashley is extremely weak and pale. Now desperate for help, the Wolfs hurry their daughter to the pediatrician for an emergency appointment.
Ashley was so ill she couldn't even walk. I had to carry her from the house to the car, from the car into the doctor's office.
The pediatrician is as alarmed as Ashley's parents.
He looked at her, one look, and said, take her to the hospital now.
After a grueling night driving back and forth from the ER, Ashley is finally admitted to the hospital, where she's immediately given IV fluids for dehydration.
I was scared to death. I didn't know what was going on.
She was extremely dehydrated, lethargic, wouldn't move, wouldn't talk.
I'd never seen her sick ever like this before.
But after she got some IV fluids, she was doing better. And I thought to myself, this must be related to the diarrhea. It has to be.
After 36 hours on the IV, Ashley recovers from her dehydration and she's discharged. But Angela refuses to leave without answers. It's then that she decides to try a different tactic.
I collected some of her stool in a clear container.
And when the doctor came in, she walked up to him and stuck it right in his face and said, does this look normal to you?
This is what I deal with 8 to 12 times a day. This is not normal. I need some answers, and I need them now.
A light bulb went off with him, and he was finally wanting to listen and hear what we had to say.
Believing they are now finally in good hands, the Wolfs begin to see the new gastrointestinal specialist regularly. After a few weeks of stool testing, he tells them their daughter has irritable bowel syndrome, a catch-all diagnosis for abdominal pain and changes in bowel habits.
He prescribed anti-diarrhea medication, and it slowed her down to maybe 3 to 5 stools a day for a while. But over time, maybe a couple months, she was back to 8 to 12 a day. I would call him, and he would say, just bump her dosage up a little bit. So we did, and it would slow her down a little bit. And the same scenario kept repeating itself. So I called him and I said, the loperamide's not working. She's built up a tolerance. We're right back where we were. She's still eating incredible amounts of food. She's having trouble in school now. She's very skinny. Irritable bowel is such a generic label. I need you to tell me what this is.
As Ashley's mysterious condition hangs over the Wolf family, the situation begins to take a toll on Angela and John, who for the first time in 19 years find themselves growing apart.
He didn't want to talk about it. I had to talk about it. He just shut down.
My number one goal at that point was to find out what I could do to help Ashley. And that's how I focused my energy.
Pretty soon they started pushing away from each other. John would go on one side of the house and Angie in the other, and of course, everything was the other person's fault.
She was very upset, and I understood that too, and I was upset as well. I mean, Ashley's been suffering for many years with this.
Then in 2001, now 8 years old and living with a constant state of diarrhea, Ashley's parents notice something else.
I noticed Ashley holding books quite a bit closer. I thought that just can't be. 6 or 7 months previous, I had her eyes fully examined. She had 20/20 vision. Then a couple nights later, we were playing a board game where you had to read some cards, and she could not read the writing on the cards. And I realized she can't see.
9-year-old Ashley Wolf has had diarrhea her whole life, and doctors can't figure out why. Now her mother Angela notices that Ashley is having trouble seeing as well. Angela takes Ashley to a local optometrist who observes something odd in Ashley's lenses. He immediately refers Angela to pediatric ophthalmologist Charles Bach.
We did a complete eye examination, and at that time we found that Ashley's best corrected vision was 2100, which is about 5 times worse than a normal person would see. The rest of the examination included dilating her eyes, looking at the lenses of the eyes, and that's when I first saw the cataracts.
And I was very shocked and surprised. I mean, how could a 10-year-old have cataracts? That's just virtually impossible.
Mostly seen in older people, cataracts are a clouding over of the lens, brought on by changes in the proteins of the eye. When the lens is cloudy, vision becomes blurred. And depending on how severe the cataracts are, corrective surgery may be required.
When I first saw the cataracts, I was struck by how unusual her cataracts looked. It was almost as if there was a snowstorm inside of the lens of her eye, with a very dense area of opacity in the back of the lens, which meant that she could barely see anything through her lenses. Cataracts in this age group are really uncommon unless they're due to trauma. It was clear that I didn't know everything about Ashley that I needed to know, and so I asked Angie a few more questions. I asked her, is there anything about Ashley's history that you have thought of while I was examining her that I should know about?
And I started going into her history in detail, the trouble in school, her eating, her diarrhea.
I said, tell me more. And she said, well, she's had diarrhea since birth.
He kept looking at the cataracts very closely. And he says, these look metabolic in nature to me. And I don't want to operate until we know what's going on.
Metabolic refers to anything having to do with your body's metabolism, how you absorb nutrients, how you process nutrients, the enzymes in your body that are responsible for carrying out any biochemical process. And at that point, I suggested that she really needed to see a metabolic geneticist.
John was with me. I said, take the kids to the car. So he took the kids to the car. I called my dad.
There was terror in Angie's voice. I basically told her she had to hold it together. Don't break down in front of Ashley.
I didn't want Ashley to see me because I didn't want to scare her. But right then, my gut told me something bad is going on.
Dr. Bach refers the Wolfs to genetic specialist Dr. George Anadiotis.
I was suspicious because of this history of diarrhea and this history of cataracts. And so off the top of my head, I couldn't think of a link between why an individual would have cataracts, involvement of the ocular system, and diarrhea, involvement of the GI system. And then there were concerns regarding her learning, so I was concerned that her neurologic system was affected. Anybody can have a problem with one organ system, but when you start having multiple organ systems affected, then the odds of these kind of things just all happening at random decrease dramatically. So the fact that she had 3 different organ systems affected make me think that this is most likely a genetic or metabolic issue, and that these things were somehow linked together.
After a thorough examination, the Wolfs are sent home. But Dr. Anadiotis assures them that he's on the case.
Dr. Anadiotis' office called 2 days later and said, we think we might have an idea of what we're looking at here. Could you bring Ashley in for some blood work? I asked her what they were looking for, and she didn't want to tell me. She said, you'll just get on the internet and scare yourself to death. So I'm not going to tell you until we're certain what's going on.
5 days later, Angela takes Ashley to Dr. Anadiotis' office for the blood tests, which he will send to a special lab. But unbeknownst to Dr. Anadiotis, while Ashley is having her blood drawn, Angela seizes an opportunity.
The nurse had stepped out of the room. I saw the paperwork sitting there. So I walked over to the paperwork, realized there was a photocopier right there, copied the first couple pages, and then put the paperwork back and took the information home with me. I called John on the phone. I told him exactly what I did. I said I made copies of the paperwork because no one would tell me what it was. I looked it up online, and it's bad. It's really bad.
Angela and John Wolfe are terrified. They are awaiting test results which will tell them if their 10-year-old daughter, Ashley, has a devastating illness that could, among other things, severely impair her brain functions. The wait is grueling.
I think it took 4 or 6 weeks. And every day, I'd have moments where I'd just break down. I hate this part.
Even though they don't yet know Ashley's exact diagnosis, with the little bits of information they've managed to get, Angela and John spend the next 4 frantic weeks researching the possibilities online.
You read what happens over time, and you think, my child's gonna go from this beautiful, normal kid to eventually immobile, mentally retarded, with a feeding tube in a nursing home. I can't let that happen. That can't happen.
Finally, after the grueling wait, the Wolfes get word that the test results are back.
I brought the family back in to talk to them at length about what's going on. And so we said, the results are positive. Ashley has what's known as Cerebrotendinous xanthomatosis.
Affecting 1 in 50,000 people in the U.S., CTX is a congenital metabolic disorder. Those afflicted with CTX lack the enzyme that the body needs to break down cholesterol. Cholesterol, in turn, builds up in various parts of the body, gradually interfering with normal system functions. This often results in diarrhea and early-onset cataracts, although physicians don't know why.
A lot of individuals present with these two findings as a common presentation. It's just that the link between the two isn't really a well-understood concept among the general physician population.
But fortunately for Ashley, she's diagnosed early in her life.
A lot of individuals who are older often may fall into the mild mental retardation category. They can also have risks for heart disease as well.
Dr. Anadiatis informs Angela and John that CTX is genetic, which means they are both carriers of the gene.
When you have 2 parents who are carriers, there's always a chance of having an affected child. So if you want to think of it as you have one, so to speak, normal gene, and you have one abnormal gene. Each parent has a 50-50 chance of passing on either the normal gene or the abnormal one. If both parents pass on the abnormal one to the child, you're going to have an affected individual, okay? But the parents themselves are completely normal.
It is a bittersweet moment for the Wolfes.
So when she finally gets a diagnosis and we finally know what she has, it's a huge relief.
I felt good. I also felt terrible because I knew that my daughter had a disorder that she's going to have to deal with for the rest of her life.
The course of treatment for patients with CTX is an obscure but easily producible drug known as CDCA, or chenodeoxycholic acid.
What it does is it replaces a component in her chemical makeup that's missing due to the mutation of the gene that causes CTX. In a normal person, they produce this type of acid and their metabolism is fine. In Ashley's case, she just simply is missing it.
However, while CDCA was heavily used in the 70s to treat gallstones, it has since been discontinued in the United States.
So chenodeoxycholic acid is made by the pharmaceutical industry for like industrial purposes, like in tons. But there's so few individuals with these kind of problems. There's not a pharmaceutical company out there that's interested in taking that huge volume and putting it in capsules.
We were very, very scared because we knew the effects of this disorder without the medication were severe and the progression was rapid, and she would end up in a bed, fed by a tube, a shell of a human.
But after a frantic search, the Wolfes finally managed to locate a source for CDCA overseas.
We were getting it from a company in Germany. We could only import 3 months of it at a time. I've thought about going over to Europe with Ashley and filling our suitcases with boxes and boxes of it before they run out.
As Ashley begins treatment, she slowly begins to improve.
Within the first month, her diarrhea had completely cleared up. After several months, she was doing better in school. She started gaining weight right away.
4 months later, Ashley's cataracts are surgically removed, and she has 20/20 vision.
Looking back over her history, I don't think anyone could have guessed just from the diarrhea that this is what Ashley has.
That's what happens in genetics, is that things are so rare that sometimes I see it and I won't see it again in another 20 years of practice. And we have a saying in medicine is that when you hear hoofbeats, you think horses, not zebras. But in genetics, the horses are all extinct. The world is populated by zebras.
Today, 13-year-old Ashley leads a normal life and is learning to understand her important role in raising awareness for her rare disease.
I feel kind of like a stronger person. It makes me feel like I can teach more people so that they can figure out if they have it so they don't get worse and worse like I was before I was diagnosed.
And Angie and John have found renewed strength as well.
I think that our relationship has drastically improved. You know, Ashley was the glue that held us together.
What do you tell a child that asks why me? I said, I think part of the reason is you're strong enough to handle it when some other children aren't. You were built to handle it.
Fortunately for the Wolf family, Ashley's diagnosis would come early in her young life. But for 25-year-old ER nurse Nissa Penland, the answers would require more patience and more pain. In 1999, Nissa Penland was thriving as an emergency room nurse. Proud of her unrelenting stamina and passion for her work, her every day was charged with critical problem solving.
I worked about 60 hours a week, no sweat, life was good.
She was a tiny little bundle of energy and strength.
Hardly ever got sick, only went to the doctor once a year.
Nissa's always been really good with a challenge, and she has a very quick mind.
I figured life would always be like that.
But in the spring of that year, Nissa starts feeling run down. Her first instinct is that she's simply fighting off a virus.
I had some fevers, chills, night sweats, just felt kind of flu-ish.
She would miss work more often. She just seemed to be getting a little more fragile.
And after 2 weeks, I thought, well, I should be feeling better by now.
A bit concerned, Nissa pays a visit to her primary care physician.
So we went over, had any recent exposures at work. I had, at that point, never had a needle stick incident at work and had no exposure. And it was just sort of a wait and see kind of situation.
But the very next day, Nissa finds herself back in the doctor's office, feeling worse.
I have a temperature of 103. I have a horrible, horrible headache, the worst I've ever had in my life. And he's concerned that maybe I have meningitis.
Meningitis is a potentially life-threatening condition in which the membranes surrounding the brain and spinal cord become inflamed. It's usually caused by bacterial infection.
Cerebral spinal fluid can contain infections that will not necessarily show up in blood work. They have to test that just to make sure that you don't have an infection in your brain that's just not showing up.
Nissa's doctor decides to perform a lumbar puncture, otherwise known as a spinal tap.
You have to hold very, very still while they do this, and you're curled up so that the bones separate, so it's easier to get the needle in between your vertebrae into the space that contains the fluid. And then they put a spinal needle in your back, and the needle is about 3.5 inches long. I knew that was something to expect, but it was a lot more uncomfortable than I had expected it to be.
A few days later, the results of the spinal fluid test return from pathology, negative for meningitis or any other disease.
Well, my worst fear is that I have a tumor somewhere or that I have cancer, because my doctor, when he was talking about some of the other diagnoses that can go along with the symptoms I have, it says that lymphoma is a possibility.
Lymphomas are cancers of the lymphatic system, a key network of glands and vessels that make up the body's main line of defense against disease.
The minute lymphoma comes out of his mouth, it's stuck in my head like glue.
For nearly a year, ER nurse Nissa Penland has endured terrifying symptoms: night sweats, fevers, and abdominal pain. But endless blood work and a painful spinal tap have yielded no answers. Now, suddenly, in the spring of 2000, she develops a new and alarming symptom.
I'm feeling short of breath. I'm having this kind of vague chest pressure. Whenever I'm up and moving around, it gets worse.
Then, one night during Nissa's shift, something really frightening happens.
I think that I was working a later shift than she was, and I think she actually was on her way home. So she had gone into the lounge, which I didn't really think anything of. Somebody else went in there and found her on the floor, passed out. And it was quite frightening for all of us. That was probably when it really came home that there was something profoundly wrong.
I'm concerned that I'm going to lose my job because I can't work.
It was obvious that she was not as capable of doing the physical work that we often have to do in the emergency room.
At this point, I'm put on a leave of absence from work.
Nissa's life is fading before her eyes, and her bank account is dwindling. Then, 2 months later, she starts to develop more symptoms.
My lymph nodes are all enlarged. They're painless, but they're all getting quite big. I am now developing some nausea, and my appetite is going away, and my abdomen has become quite bloated.
Nyssa returns to her doctor, who runs a CT scan of her abdomen. To her horror, the scan shows a 1.5 centimeter lesion on Nissa's spleen.
I was so upset by that. I'm getting more and more concerned that I do have cancer, because lymphoma definitely shows up in your spleen. So at this point, I want to know what it is, and I want my spleen taken out, and I want it to get examined and tested, because if I have cancer, I want to have it taken care of now.
The spleen, which acts as a filter in the fight against infections, contains thousands of blood vessels and cannot be biopsied because of the risk of hemorrhaging. The only alternative would be to remove the entire organ.
The doctor was concerned about removing my spleen because it does have an important role in your immune system, and I think he wanted to take more of a wait and watch approach to see if the lesion got bigger.
If you had something growing inside your body, and all of your caregivers said, well, let's just wait and see what it does. Anyone would want to know.
He still does not want to take my spleen out and recommends that maybe I need to be referred to a pain specialist or a pain clinic. I was so upset by that statement because I felt like he just didn't want to deal with it anymore and that he was tired of dealing with me. It made me feel like there was something I needed to be ashamed about. And at this point, I really felt like he wasn't listening to what I was saying.
Frustrated, Nyssa immediately gets a referral for a new doctor.
So the new doctor that I'm seeing, he says that with all of my big lymph nodes and my spleen is getting larger, we need to get you in to see a surgeon, and we need to get that out and looked at and sent to pathology, because I'm really concerned that you may have lymphoma.
After 8 months of questions but no answers, Nyssa has finally landed on the operating table, where she is opened from the ribs to the belly button for an exploratory surgery and to remove her spleen.
My surgery showed that I had an enlarged spleen and that there was a mass in it, and that I also had an enlarged abnormal lymph node right next to the spleen where the mass was. So I had those lymph nodes removed as well.
1 week later, Nyssa receives a disturbing follow-up call from the surgeon.
The surgeon called me, it was in the evening, said, well, I'm sorry to have to tell you this, but it really looks like you have non-Hodgkin's lymphoma. And it sort of felt like the floor dropped out from underneath me. After I got off the phone with the doctor, I called my mom and said, Mom, they told me I probably have cancer. What am I gonna do?
I kind of fell apart inside. I didn't, I was trying very hard to recall him over the telephone because she didn't need me falling apart when she needed somebody to lean on herself.
I'd had to tell patients before, I'm sorry, but we've found cancer in whatever scans we've done, but to be the one that's told that you have cancer, you feel like your life is just completely out of control.
Eight days ago, Nissa Penland was under the knife for a splenectomy and exploratory surgery. The pathology on the spleen is now back from the lab, and her doctor has just told her that she may have cancer, but they can't be sure.
Being told we're not exactly sure, but it really, really looks like you have non-Hodgkin's lymphoma. You can't do anything about it because they're not going to treat anything until they know exactly what it is.
Terrified that a cancer might be growing inside her, Nyssa makes an appointment with oncologist Dr. Sheldon Goldberg.
Giving a patient vague information is probably the worst of all situations. I know that personally because my own daughter had leukemia, and I knew that having an answer was a great comfort, even if that answer is bad.
Dr. Goldberg finds a pathology lab that can do even more refined tests on the growth on Nyssa's spleen. Within a week, the results are back.
We were unable to get a clear idea, other than this was not a clear malignancy. The cells did not come from a single cell, but came from several different cells, and so it could not be considered malignant.
The final pathology came back, and I didn't have cancer. It wasn't normal. It was inflammatory tissue, but it looked like lymphoma, but it wasn't lymphoma.
The relief is immense. But if it isn't lymphoma, then what is causing these terrible symptoms? Nyssa and Dr. Goldberg are desperate for answers.
My platelet count is going up, which can mean inflammation.
I came to realize that her condition was not a blood problem, was not a lymphatic problem, but it was an immune problem. It was a problem of the immune system, like an arthritis.
Dr. Goldberg suggests that she might find temporary relief from anti-inflammatory drugs, and proposes a drug called thalidomide.
I grew up in the 60s, and thalidomide to me was the babies that were born with their hands on the ends of their shoulders and horrible, horrible birth defects.
In Nyssa's case, this terrible side effect is irrelevant because Nyssa is not pregnant, and because the other side effects are no worse than those caused by other anti-inflammatory drugs of its class. Provided Nyssa takes precautions not to become pregnant, Dr. Goldberg sees it as a viable course of action.
This medicine now seemed to quiet inflammation in a very significant way, and was being used for things like the loss of weight that accompanies AIDS and other highly inflamed states. I discussed with Nyssa whether we might try that and proceeded that way.
Desperate, Nyssa agrees to start taking the drug.
Within a couple weeks, I'm starting to feel better. My energy is better. My fevers are better. My night sweats are better. And I'm thinking, God, finally.
She felt more human. I think she was even able to go back to work.
I'm still exhausted by the end of my shift, but at least I have that normalcy back in my life.
But after a few weeks of relief, Dr. Goldberg informs her of a new piece of disturbing information regarding her white blood cell count.
And he walked into the room and he had my chart and he said, your labs came back and your white blood cell count is very, very low.
I thought that we should investigate this problem right away because, first of all, getting a quick answer is the best way to deal with the problem, both medically and emotionally. And the way we dealt with it was to do a bone marrow examination so that we could look at the factory where blood is made.
I had seen bone marrow biopsies and I knew that they were notoriously painful. I didn't want to do it, but I knew I needed to do it.
We gave Nyssa some medicines in her vein to make her experience less pain.
So I got the medicine and I started to feel kind of woozy and a little drowsy. And he started numbing it up the area. And I remember looking over at the tray that he had set up and seeing the biopsy needle and thinking, I can't believe he's going to stick that in my hip.
And after we anesthetized the back of the hip locally, we put a boring needle in there.
And I felt like my bone was on fire. It was the worst pain up to then that I had ever had in my life. And I remember moaning on the table with tears pooling on the side of my head.
After an excruciating 15 minutes, the painful procedure is finally over. The results will take 3 days.
There I was, waiting again hoping for an answer to something.
That report showed that there was a decrease in the number of cells that produce the white blood cells. And that's characteristic of a drug reaction rather than a progression of some underlying disease.
Anti-inflammatory drugs can suppress the immune system. Dr. Goldberg quickly realizes it is the thalidomide that is hindering the production of white blood cells. Nyssa is forced to stop taking the drug, and her debilitating symptoms gradually return. Again, she is compelled to take a leave of absence from work. She feels her life is slowly slipping away.
I've sort of felt like I'd lost my purpose. If I can't work and I'm not a nurse, then what am I?
By January 2001, for 2 years, ER nurse Nissa Penland has suffered mysterious, debilitating symptoms. Painful tests and invasive surgeries have led nowhere. But hematologist-oncologist Dr. Sheldon Goldberg now suspects Nyssa may have an elusive inflammatory condition. He refers Nyssa to Dr. Steve Overman, a rheumatologist.
Rheumatology really is the discipline where, in a sense, we're the last resort in trying to figure things out. That's sort of the point at which Nyssa came in, and we started our journey together.
He welcomed me and said, well, let's work on this together and see if we can figure something out.
Dr. Overman and Nyssa first review the entire history of her illness. As a next step, he scans the lab work on her spleen and lymph nodes.
We already knew that the specific cell types were not cancer, and we knew that she did not have an ongoing infection that we could prove. Therefore, I accepted that Nyssa had a rheumatic illness that I couldn't put a specific label on.
Then, in March 2002, during a routine visit with Dr. Overman, Nyssa tells him about one of her latest symptoms.
My right hand felt kind of achy. My fingers were really stiff. And I noticed that my knuckles are quite big, and they're red and incredibly painful. He looks at my hand and he goes, wow, look at those. And then he starts asking me, have you ever had this salmon, kind of a pink colored rash on your chest or your neck or anywhere? Well, yeah, and sometimes it's a little itchy, but it goes away as quickly as it comes. I don't really pay any attention to it.
All of a sudden you say, bingo, I know the pattern. It's like when you're looking at slides or in college and you'd see dots on the screen, and you keep blinking until all of a sudden you see this, the rabbit and the dots, and once you've seen that pattern, you never forget it.
He got this big smile on his face, and I thought, what in the hell is he smiling about?
I went and got one of our books and copied a page and gave to her, and it just sort of like, wow.
So he hands me these photocopies, and as I'm reading through it, I said, this is me. Just about every single symptom is me.
You remember the look when sort of the pupils dilate and there's all of a sudden that sense of, aha, the light goes on. I know I shared that moment with her.
And he said, I know what you have. You have adult Still's disease.
Still's disease is a chronic inflammatory condition in which cells in the body, for no known reason, become inflamed and begin disrupting normal functions. These inflamed cells would explain Nissa's high fevers, as well as her enlarged spleen and lymph nodes. Adult-onset Still's disease is extremely rare, affecting approximately 1 in 100,000 people.
The bad news is that when left untreated, the inflammatory condition certainly increases the person's risk of infections. It can affect many organs, and there have been cases of liver failure associated with Still's.
There is no simple test for Still's disease. It is a clinical diagnosis based primarily on symptoms, which makes diagnosis difficult.
She didn't have the rash, she didn't have joint symptoms until a couple years into my seeing her. So she did not have the typical picture, and that's either because it was slow to develop or it was partially treated and therefore we never got the full picture.
I think because of the mass in my spleen, the doctors veered towards lymphoma, because at that time it seemed to fit that picture better.
It was kind of a relief to know that there was something and that it had a name.
It was almost like a kind of a celebration.
There is no cure for Still's, but Dr. Overman recommends Remicade, a drug that targets specific proteins in the body's immune system to help control the development of inflammation. This can significantly reduce the painful symptoms associated with Still's.
I felt like I became a complete person again, and life got a little brighter, and the roses smelled a little sweeter.
She looks healthier than she has for several years. She's able to enjoy her work without being sick all the time.
The good news is we diagnose earlier, we treat more aggressively. I think Nissa's prognosis is excellent.
In time, Nyssa is back to normal and back in the ER, but this time in her expert role as powerhouse nurse.
I thought, well, why did my fingers wait so long to find it swell up? Why did this have to take 4 years?
I think that the autoimmune diseases, the inflammatory diseases, those ideas are still evolving even now. Those patients go undiagnosed longer because our ideas about autoimmune diseases are evolving.